Ask not for whom the bell tolls. It tolls for H-1B. On September 19, 2025, the White House issued Restriction on Entry of Certain Non-Immigrant Workers, a presidential proclamation to restrict entry of H-1B specialty occupation workers unless the worker's petition is accompanied or supplemented by a payment of $100,000. The restriction takes effect 12:01 a.m. Eastern Daylight Time on September 21, 2025, runs 12 months unless extended, and allows the Secretary of Homeland Security to grant national interest exceptions to individual workers, whole companies, or even an entire industry. The text also instructs state to curb B-visa misuse, requires employers to retain proof of payment, directs state to verify it, and authorizes DHS state to deny entry for non-payment. By scope, it applies only to entries occurring after the effective date. A same-day White House fact sheet framed the $100,000 as a payment that accompanies or supplements new applications, while the proclamation itself is entry-based, creating immediate ambiguity for universities trying to interpret who is charged and when. Subsequent press guidance further muddied the picture. Some outlets initially described the fee as annual, while later Reuters and AP updates quoted White House officials calling it one-time and not applicable to existing holders or renewals, a clarification that still sits uneasily with the proclamation's plain entry trigger. Today, we'll trace the impacts of the $100,000 entry fee on universities. We begin by examining its direct impact on instruction, research, and clinical staffing, where vacancies and delays emerge almost overnight. We will then turn to the economic contradiction at the heart of the policy, showing why it cannot raise wages for U.S. workers. From there, we look at the limited visa substitutes sometimes proposed and the sector-wide scale of exposure the policy creates. Finally, we outline the steps universities must urgently take and explain why, in both logic and practice, this policy is self-defeating for America's own educational and scientific strength. For higher education, the implications are immediate and severe. Universities depend on H-1B visas to recruit tenure-track professors from around the world, to bring in postdoctoral researchers who keep labs running, and to staff academic medical centers with physicians in critical specialties. By conditioning entry on a $100,000 payment, the proclamation strikes directly at these pipelines. Departments now face impossible choices. A physics department ready to welcome a new assistant professor from Europe must either pay an extra 6 figures or leave courses unstaffed. A biomedical lab counting on postdocs from abroad faces months of delay unless it can shoulder the surcharge. A teaching hospital with H-1B physicians in oncology or neurology risks gaps in care every time one of them leaves the country for visa renewal. Universities cannot simply shift money around to absorb these costs. Most operate on tightly balanced budgets, where faculty salaries are set by state appropriations, tuition revenues, or grant awards. Add a $100,000 per entry toll and the math breaks. Fewer hires, lower salaries, or canceled lines. The proclamation doesn't just raise costs, it reverberates through every core function: teaching, research, and patient care. And because the fee is linked to entry, it also discourages the very mobility that defines modern academia. Faculty may skip conferences, cut off international collaborations, or avoid family visits for fear of being locked out. The United States' reputation as the global hub of scholarship rests on attracting and circulating talent. This policy replaces openness with a toll booth, and it begins charging immediately. The consequences of the $100,000 1B entry fee become clearest when traced through the daily operations of a university. From the classroom to the laboratory to the teaching hospital, institutions rely on international faculty and staff at every level. What looks on paper like a surcharge quickly translates into canceled courses, delayed research, and gaps in clinical care, disruptions that strike at the heart of the university's mission. Universities will feel immediate stress in their teaching function. Tenure-track recruitment often relies on global candidate pools. If a finalist is abroad, entry is now blocked unless the institution pays the fee. Adjunct and visiting roles, likewise filled by international scholars, will go unstaffed. Contingency staffing is already overburdened and cannot absorb the sudden loss of scheduled instructors. At a mid-sized university, if 10 of 20 annual hires are from abroad, The cost of entry alone could reach $1 million. If 50 existing H-1B faculty travel for conferences or family visits, their return could add another $5 million. Even if universities decline to pay, the operational consequence is the same: loss of access to those faculty. The research enterprise is perhaps even more vulnerable. Postdoctoral hiring is majority international. Nearly 6 in 10 U.S. postdocs are on temporary visas. Grants often depend on timely starts, and delays risk penalties or reputational damage. Collaborative fieldwork and consortia, which demand international mobility, now carry the risk of blocked re-entry. Consider a molecular biology lab with 4 of 7 staff on H-1Bs. 2 new postdocs are awaiting arrival, and 1 senior postdoc is returning from fieldwork. The lab faces either $300,000 in additional costs or 6 months of operational gaps, threatening its NSF deliverables. Teaching hospitals are CAP-exempt but not entry-exempt. Their physicians on H-1Bs must still pay the fee or obtain an exception. Subspecialty services such as neurology or oncology rely on these staff, and service gaps jeopardize patient care. Visa stamping trips, routine for clinical staff, now risk multi-million-dollar penalties. A hospital with 20 traveling H-1B physicians could face a $2 million exposure in a single year. Behind the scenes, university HR and immigration offices face a surge in workload. Each case now requires evaluation under 3 policy scenarios: one-time, new-only, or annual, plus preparation of national interest exception petitions. Departments must document and retain proof of payments, coordinate with counsel, and monitor evolving DHS and state guidance. The administrative burden compounds the financial one. Proponents of the $100,000 fee argue that it will level the playing field by making foreign hiring more expensive, supposedly forcing universities to raise wages for U.S. workers. But the economics of higher education budgets don't work that way. A department's budget is fixed by state appropriations, tuition, and grants. Introduce a flat $100,000 tax on every international hire and something has to give. Either the department hires fewer people, or it lowers the salaries of those it does hire. This is not theory, it is math. Imagine a department with $2 million to cover 10 faculty lines. That means $200,000 per line, including salary and benefits. Add a $100,000 fee per line, and suddenly the budget only supports 2/3 of the salary it did before. The department cannot magically increase its budget to offset the fee. It will cut positions or suppress salaries, and the supposed wage benefit evaporates. The result is a policy that hurts domestic and international candidates alike. American faculty see frozen wages, international scholars see frozen job offers, and students see fewer faculty in the classroom. Instead of protecting U.S. workers, the policy makes universities less able to pay anyone more. Some defenders of the proclamation will point to alternate visa categories as a way out. But the supposed substitutes don't withstand scrutiny. The J-1 visa, often used for visiting scholars and postdocs, cannot be issued for tenure-track positions. It carries a 2-year home residency requirement that forces scholars to leave the U.S. before they can adjust status. It also prohibits repeat use, meaning that once someone has served as a J-1 professor or researcher, they cannot simply renew indefinitely. For postdocs or short-term lecturers, J-1 might work in limited cases. But for the backbone of a university, the tenure-track faculty, it is a dead end. The O-1 visa covers individuals of extraordinary ability. It is a viable route for Nobel laureates, MacArthur Fellows, and other star hires. But most assistant professors, however brilliant, will not yet have the publication record, press coverage, and national awards necessary to qualify. Building an O-1 petition also requires months of attorney work and significant costs. It is not a scalable or affordable path for early career scholars who make up the majority of new hires. The reality is that J-1 and O-1 visas can patch a handful of cases at the margins, but they cannot serve as a substitute for the thousands of H-1B positions universities fill every year. To understand the scale of risk, it helps to zoom out. Universities collectively sponsor about 24,500 H-1B recipients each year, counting both new hires and renewals. If even a quarter of those cases involve international travel or first-time entry, that's 6,000 entries. At $100,000 per entry, the total cost would be $600 million in a single year. That is not a hypothetical number. It is a system-wide exposure that would rival the entire federal research budget for some disciplines. Now zoom in. A major public research university might employ 300 H-1B staff and faculty. If 75 of them travel in a given year for conferences, fieldwork, or family reasons, that's a $7.5 million exposure. Even a wealthy private university cannot casually absorb that. For smaller institutions, even a few cases could derail entire departmental budgets. These figures also mask the qualitative harm. When a department cannot bring in a specialist because the entry fee is too high, it doesn't simply lose a hire, it loses a field of study. A medical school without neurology residents cannot teach neurology. A physics department without particle theorists cannot train the next generation of particle physicists. The fee isn't just a tax on entry, it is a tax on knowledge itself. The first step for every university is to stop international travel for faculty, researchers, and physicians on H-1B visas, unless a clear exemption is in place. Each trip now risks stranding essential staff abroad or triggering a $100,000 entry fee. Institutions must move quickly to identify who is currently outside the country, who has pending travel plans, and who is slated to arrive from abroad. Second, higher education must band together immediately. Individual case filings will not work at scale. The only realistic option is to press the Department of Homeland Security to grant a sector-wide national interest exception for universities and academic medical centers. That lobbying should start yesterday, coordinated through groups like the AAU, AAMC, and AC. Third, universities need to revise their hiring playbooks. Searches that assumed global candidate pools will have to be restructured with more lead time and contingency planning. HR and legal teams must also begin screening where J1 or O1 visas might be used as imperfect substitutes, even if those categories cannot cover tenure-track roles at volume. Finally, administrators should document every disruption, courses canceled, labs delayed, clinics understaffed, to build the evidentiary record for the inevitable litigation or legislative relief push. To understand why this policy is so corrosive, consider how cause and effect works here. The chain is simple. A government action, the $100,000 fee, leads directly to a university reaction, blocking travel and freezing hiring, which produces measurable outcomes. Courses unstaffed, research delayed, patients left waiting. That's a causal chain in the most basic sense, but there is another way to think about it. Once you close the gate and deny entry, everything behind it collapses. Faculty cannot teach, labs cannot operate, hospitals cannot staff rotations. This is what scholars of systems call a bottleneck effect, one blocked point that starves the entire system of output. And finally, there is the dissonance this policy creates. By cutting off international expertise, universities fail to hire the very people they need, and in turn they fail to deliver education, research, and care. It is a feedback loop of failure, where the government's supposed cure directly causes the disease. At bottom, this policy is not about raising wages or protecting American workers. It is about erecting a toll booth at the nation's intellectual border, charging $100,000 every time a scholar or physician seeks to enter. Universities cannot pay it, so they will simply stop hiring, cancel courses, and watch research projects stall. The effect is a deliberate impoverishment of the country's own institutions of knowledge and innovation. If the goal were to strengthen the United States, you would design policies that attract the brightest minds, fill our classrooms, power our labs, and keep our hospitals running. This measure does the opposite. It strangles the pipeline of talent, imposes a crushing cost without delivering a wage benefit, and hands an advantage to every competitor nation eager to recruit the scholars and physicians we turn away. This is, in short, a self-inflicted wound, a policy that confuses punishment with protection and, in doing so, undermines the very foundations of America's research and educational strength.